go ahead and give that IM injection. So we are going to give our flu vaccine in the patient's deltoid. So I've got my appropriate syringe, the 3 ml 25 gauge with a 1-inch long needle. Remember, I've opened it. Again, this one doesn't have a safety on it. I have cleaned the top of my vial already for 15 seconds. Take this off. I'm going to draw up my 1 ml of air. I'm going to inject it into air, not into my liquid, so it won't be bubbly. I'm going to invert it, and I'm going to carefully pull back my 1 ml, being careful not to get air bubbles in it. If you do, you have to kind of flick it to get the air bubbles up to the top, and then you can push the air back into the vial. There we go. Got 1 ml. Turn it back out. So there's my 1 ml. This does not have a safety device on it. Again, you never recap a syringe. You always put the safety device back up on it. You don't want it to click all the way, because once it clicks, you cannot use that needle again. But I'm going to, for the sake of me putting my gloves on, I'm going to scoop it with one hand. Again, that's never an answer on the test. You never scoop anything. You use the safety devices. And I'm going to put my gloves on. I've done my hand hygiene. I've done all my AWOPs. I've identified my patient. I've checked my medication 3 times, and I'm going to give it. And I'm going to use my arm here again to show you. So this is my arm. Again, a deltoid. We're going to hold the arm flat. We're going to measure for the clavicle and the acromion process and make a V, or we're going to do 3 finger breaths down on that patient. Also, when giving an injection, an IM injection or any injection, you need to see, is it appropriate? Let's say I've had a stroke on this side, then I don't need to give an injection in this side. I need to switch it to another side or to another muscle. So I've got this, and we're going to give an IM injection at a 90-degree angle. And I'm going to show you with this one, and then we're going to talk about doing the Z-Track method. So we've identified our patient, we have done everything, and we have measured. I'm going to show you the angle and the technique that you use. Because some people want to be hesitant, they want to slow down, and you do not want to do that with giving an injection. Open it. I've located my 3 finger breaths down. I'm going to clean my area. Again, put a little pressure behind it because you want to clean the skin. Some patients, you may have to get another alcohol pad. Maybe they're a little dirty. Maybe you're working the emergency room and somebody's came in and they've been at work, and you don't want to give an injection through dirty skin. So I'm going to clean my area. To remind me where I did, I always leave my alcohol pad there while it dries. I'm going to take my cap off. Now I'm giving an IM injection, so no matter where it's at, if it's on your deltoid, if it's on your leg, you want to pull the skin taut. Because if you've got wrinkly skin and you're putting this needle in, it will bunch up. It will not go smoothly. Because some people have got really easy skin, like going through like butter, and sometimes it's like putting a needle through a tennis shoe. And that's not a good feeling. So you pull the skin taut at a 90-degree angle. Remember, I am 90 degrees. And that's why you want to pick the right size needle, because if this patient's arm was T90, of course you would not use this on a baby, you'd hit the bone. So really think it through when you choose your needle size. Pull the skin tight, 90-degree angle. Notice how I'm holding it. You don't put your finger up here on the plunger. You don't do that. 90-degree angle. 1, 2, and 3. Then you can kind of let go, hold it here, inject your medicine in slowly. Then you always let it set just a second. Pull the needle straight out. Put light pressure. Activate your safety device. Put it in the sharps container. Even though you've got a sharps container, you need to go ahead and have that safety device put on there if it's there, and put it in the sharps container. That way it's kind of a double safety device. So we're going to put light pressure. You can rub a little bit if you like. Again, you definitely never rub on anything that is an anticoagulant. So that is our IM injection. Now, for the sake of time, I'm going to show you how to do an Z-Track. Sorry, didn't mean to squirt you. I'm going to go ahead and drop a little bit more medicine so I can show you something. Of course, I would never use this on again, but for the sake of time, I'm going to show you a Z-Track. So I'm going to drop a 0.5 ml. So how many of you have gotten an injection before, say a flu vaccine or maybe a steroid injection, any type of injection, and then as the nurse takes the needle out, there's a little bit of ooze, or the medicines look like it's every bit coming back out? And that's very common. But the goal is to put it in the muscle so it won't do that. So anytime you take off gloves, you wash your hands. So the Z-Track method, that is normally, so pretend this blue line is your skin. If you, like we just did, when you put the needle straight in, the medicine goes in. So that means the hole to the outside where the needle was comes straight out. So that's why you get some seepage or some oozing out of that area. The Z-Track method kind of makes it a little harder for that. It makes sure it kind of seals it in that muscle so that the medicine doesn't seep back up into the subcutaneous tissues. The Z-Track method requires you to kind of pull back a layer of the subcutaneous fat, put the needle in. So here's this is a crude drawing. So you're going to draw back. This little hump here is a little bit of fatty tissue. You inject the medication in to the muscle. And then as you pull the needle out, you let go of that fatty layer of skin, and it kind of seals back over that hole in the muscle. So instead of having a straight line to the medicine, you've got literally a Z or a zigzag, so that medicine cannot come up directly and out the hole that you put it in. So like this on our mannequin here, on my pantyhose here with rice. For example, if I pull back a layer of fat, let me do it with my other hand. Okay, so I don't have gloves on, but I'm just going to show you. You can do this on their thighs. You can do this on their ventrogluteal areas. But you pull back a layer of the fat, like that, see? Then you would give the injection in. You would inject it slowly. Then as I pull that needle out, I'm letting go of that sub-Q tissue, and it seals back over that hole in the muscle. And that is your Z-Track method. Now again, that's up for the nurse to decide. I'm going to put this in my sharps container. The doctor will never order that Z-Track method, and some of them may. The ones I've experienced have not. But say you're giving a medication that you know could be painful. Then it's up to the nurse to say, okay, I'm going to do that. Or a medicine that you don't want seeping up into the sub-Q tissue. If you were giving some sort of iron injection, that's when I used to do it the most when I practiced in the hospital, because you would want to seal that into the muscle, because if the iron injection seeped out into the sub-Q tissue, it would permanently stain the skin. So you would want to be sure that that is sealed in the muscle as much as possible. So that is your Z-Track method, and I hope that helps you.